Sujay, I am so happy to see your face. How
Risa,
are you?
I'm super excited to be here and see you. My gosh, it's been a while, but how have you been doing?
I'm good. I'm really good. I just want everybody to know that Sujay is just like the psychiatrist extraordinaire, but we met like completely, not as a doctor patient or any in sort of professional manner, but it was doing house hunters.
Yeah. What a strange place to meet and find a good friendship.
No, no, it was amazing. It was amazing. And then, I just felt like just during those days where we were filming together that we just I don't know why, but I just felt like we just connected really strongly. And once I found out about more about what you do, which I'm really really excited to share with other people about all the important work that you do, um, I just knew that I wanted to do a formal interview with you. So here we are today. And mental health is something that I think a lot of us struggle with on various levels. I don't think anybody is immune to, having some sort of, you know, um, mental health. I don't want to say disorder, but
Yeah.
like, different
Impact.
degrees, right?
Sure, yeah. No, mental health is become more of a challenge for all of us because we're living in uncertain times. And, I think we anticipated that COVID was going to impact more and more people than we had struggling before the pandemic. But now I'm seeing everybody, people who have kind of the precursor to depression and anxiety, stress and burnout, but also people who have developed depression and anxiety that probably wouldn't have developed this if we weren't, dealt this card of, financial, economic instability, political instability, wars, and so it's my work has just like tripled in the last couple of years, and so I'm really concerned for all of us, but try and stay positive.
Yeah. Well, I do think that there is a way out.
Yeah.
Everything is temporary, but uh, not to be, completely, wah wah
Yeah,
from
yeah,
the
that's
very beginning. Like there's nothing we can do about it
yep.
at the end. No. But before we kind of get into kind of what's been happening out there and some of the things that we can do for ourselves, I'd love for you to share a little bit about uh, just your background, right, as a psychiatrist, and your interest in it, and kind of some of the goals that you have in the field.
Yeah. So, I grew up in Newfoundland on the kind of most easternly point of North America. And I grew up in a family of immigrants. My dad was a doctor, my mom a homemaker. And throughout my childhood, I got to see how healthcare providers can really, change people's lives, not only just by providing medicines and diagnoses, but just being a good listener, understanding people where they're at, understanding, the society and community that, surrounds them. And I love seeing that. And I think my dad had a special, skill in listening to people and understanding them before deciding on diagnosis and treatment. And so I, kind of took that knowledge and experience and started to my own track of medical training. And I did my medical training in Ireland. I picked there over Canada because, well, it's Ireland, such a beautiful place to be. But also, my father trained there as well as my uncle, and the training there is, you know, internationally known, a very traditional program.
Wow,
And then
I wouldn't have guessed that Ireland would be that country.
yeah, no, so a lot of people around the world go there to train. I think they're just known for it, and we see the Irish graduates that come back to Canada and North America are very skilled, are often taking leadership positions, and are paving the way in medicine. So I'm hopeful that that has had an impact on me. Um, I went from loving physical medicine that I saw that my dad provided in his life, and I realized mental health was really really important and had a massive impact on me because I realized, there was a lot of work to be done in terms of getting people's buy-in and acceptance, especially in my own culture. I come from an East Asian culture where we didn't talk about mental health. I don't think I even knew what mental health was until I went into medical school.
Yeah,
Um,
same
and
here.
so, I felt that, someone from my culture needed to kind of be a leader to help provide some voices to those individuals who are struggling because mental health knows no boundaries, as we said. Did my psychiatry training in Newfoundland, and then moved to Central Canada. And right away, found myself in leadership programs, developing new state of the art treatment programs. I was kind of lucky to get those roles, but they also were a natural fit for me because I loved starting new things, developing evidence-based models, and so I've done that now dozens of times in different areas of mental health. And one of the areas that I'm very passionate about is taking our learnings and our models from North America and bringing them to developing countries, which where they're 15, 20 years behind, dealing with problems that we have overcome. People with severe depressions, high suicide rates, countries that have so many psychosocial problems that impact mental well-being. Not that we don't have our own, but there's places that are much less fortunate than us. And so started my own charity called Mental Health Without Borders. Well, I'm not the only one. There's several of us who do that, and we've taken all the love that we have here in Canada and brought it to our first country, which is Guyana in South America. And we picked that country for several reasons. We picked it because of, well, obviously, the English language made it easier for us to provide care, but also it's one of the countries that has the highest suicide rate in the world. And they have the least amount of mental health supports in the world as well. When we started a couple of years ago, there was one psychiatrist for the entire country.
That is insane. Like I don't even know. I I I can't imagine. And that psychiatrist was Guyanese or
He was
a foreigner?
Guyanese trained in Cuba.
Oh wow.
Yeah.
What a brave person, my God.
You know
If you're
what?
the only one in the country, like people must look at you like you have five heads. Like, what are you doing?
So it's very
Um,
interesting. Yeah, like it was very powerful meeting him because um, you would think that he would be burned out, exhausted, and ready to retire, but it was quite the opposite. He had a lot of energy. Doing mental health work is hard. If you spend time listening to people, taking on the stressors that they're experiencing and telling you about the traumatic events, it's exhausting. And so this gentleman, this psychiatrist, was seeing 50 to 100 patients a day, listening to all kinds of challenges, and still had a spirit of positivity that was very endearing. So I had to want to help him. And then also the love of me doing work in developing worlds, it also allows me to bring back some humbleness. And I let people know, we sometimes, whine about things that are simple, simple issues. We, in the hospital, I get really, I tell this story all the time. People are, I'm dragged into meetings about whether or not we should be wearing sandals or closed sandals versus open sandals. I'm having meetings about that and talking to hospital administrators, and we having group dialogues, and I'm like, all those hours we could have been helping 100 or 150 people in another country. So we've created a lot of things that we don't need to worry about, I feel, here. And so I love going there, and then I realize some of the static that I need to remove in my work and my day here. I can do it effectively, and kind of set my compass again to do what's important.
yeah, I guess it really is a really great effective way to kind of clarify your priorities, right? In terms
Exactly.
of,
Yes.
in this time that I have here, what am I going to do?
Yeah.
Um, we started this conversation talking about COVID, and how we're kind of officially out of the pandemic, but of course it still lingers, and how I think many of us are personally feeling the angst of this post pandemic and what all that did to us, which we probably couldn't really identify or articulate what was happening. Um, on a personal scale and also on a mass scale, because I think
Yeah.
society is also suffering as a whole. I mean, I don't know what your observations have been in terms of what's going on in Canada and then also with your patients, but what have you been observing, kind of overall, especially like kind of this like 2023? I feel like 2023 there was just so much like emotional stress
Mhm.
on so many levels.
Yeah, no, Risa, you're right. I don't think anyone would disagree with you that 2023, was a year of very mixed feelings, I guess. I think some of us were excited that, we heard that the pandemic was formally over. Um, but I think then, many of us realized we were left with a lot of residual impacts from COVID. And, those include, economies that are struggling, that are on the near brink of failure, um, the economy having impacts on households, affordability of homes, and businesses, kind of falling at record rates. Um, we're facing more global uncertainty also through wars, and the media. You cannot not look at the news and see good feel stories anymore. We're seeing images and stories of just you know, sadness, death, and that just makes us as a society feel more negative and sad. And I think, and certainly at my level, at the psychiatrist level, I'm seeing higher rates of mental health disability. People are burning out. Of course, during the pandemic, it was, people were burning out at the front line because they were just dealing with death and uncertainty. But now we're seeing stress and depression and anxiety in, I won't say everybody. I would say probably everybody in some form, but in a lot more form, in a lot more people, we're seeing full-blown depression and anxiety. And to the point here in Canada where our wait time for psychiatry has almost doubled or tripled. People are
Wow.
waiting a year or 2 years to get access to psychiatry. um, you know so people are struggling, and that problem isn't going away anytime soon. I think we're going to be dealing with this challenge, for years to come. And it's not only in adults; we're seeing this also in young people. You know, um, the the number of calls I get from parents who are struggling with kids with depression, with anxiety, with eating disorders. We're seeing an increase in eating disorders. And then suicidality. That's the biggest change I'm seeing in children. More kids are attempting suicide. Kids are
Really?
more
Wow.
negative, and yeah. And so I think we've got a lot of rebuilding to do. I think you're right, as you said at the outset. I'm very optimistic. I think once we get past this year, January 1st come, I think we all as a society hopefully can kind of set some positive goals, not only for us as a society and as a world, but also individually. I think there's a lot of stuff that we've learned from COVID that I think is positive. Certainly, I've taken some positive feedback from COVID, in the sense that I renewed my sense of kinship. Family became more important because I was spending more time with my family, and I started to, learn more about my family than I would have learned if I just kept the routine of going to work, dropping kids to school. You know, now I'm learning more about them. I want to spend more time with them, and I realize life is short, and relationships are the most important things. And so, I hope as a society we start to kind of think about those priorities, and I hope government leaders also help us through these difficult times. Dealing with the economic uncertainty. I hope we get the media also balancing the stories that they share. Right now, there's too much negativity to the point where I think it is impacting our mental well-being, and I think that we have to kind of find some balance in news stories, because we all COVID has brought more of our eyes to media than ever, because we were searching for information when COVID hit us. Everybody got addicted to looking at the numbers, so people are still have their eyes on media, but now we've got such negativity and trauma there that either we have to take a break from that, or we have to encourage our media leaders to bring more positivity to the world.
Yeah, no, I so wholeheartedly agree. I think there's something that's like media trauma is actually a thing, I think.
Yeah.
Whether you get it on TV or social media or whatever, I just know that if I scroll through social media, like if there's something that's kind of really traumatic, it's really hard for me to stop, right? Like I just have to go through it, like I have to scroll through it very quickly because it really does affect me.
Yeah.
Unless I know there's something that I can do to help, right? And
Yeah.
I feel like this year, 2023, granted, this is going to post in 2024, but like 2023 really was a year of kind of confronting a lot of these things, right? And I feel like now 2024, I kind of want to do this deep cleanse, right? And just reset and give a chance to like sit quietly and like, and it's not about, for me, it's not about popping pills, right? And just suppressing all of these symptoms, but can we use this as an opportunity to learn about ourselves and to really get healthy, not only physically, but mentally.
Yeah. I think, January 1st could be a great change point for any of us. In general, January 1st is always a reset for people, better eating goals, better lifestyle goals, better goals for, work pursuits, family pursuits, social pursuits. But I think this year, this January, I think as a society, January 1st would be a good point to make some change. We've just kind of come out of probably the most difficult time in our generation, and certainly there's going to be some storms ahead for sure. But I think resetting is a great idea, and just leave the baggage behind us. Take the learnings from the past experiences in the few years that we've struggled, and resetting our priorities. So I know for me, I kind of buried myself in work to escape from the negativity in the media. I had to work harder because I had bills to pay, and it was becoming harder for me to afford those bills. And so work was my solace. But I realized that was a really terrible way to, deal with my own stress. And so fortunately, I have family and kids who remind me that, I tell my daughter to sometimes, to get a good compass bearing, I say, can you imitate daddy? And, and when she does that, these days, it's like, looking at his phone and talking on the phone and, scrolling. And so I realized that I gotta reset things, so I want to, so my
Wow, what an
January
eye
1st,
opener, huh?
it is, and it's great technique to, get a good glimpse of who you are to others. Ask a young kid to, imitate you. and it's it's a very harsh reality sometimes. Um, but it's eye-opening, right? I mean, my
Yeah.
wife can tell me you're always on the phone. My parents can tell me you're always working, but I just kind of it goes into one ear out the other. When a child imitates you, it is shocking because they obviously the innocence and that they provide makes you more motivated to change your behavior. When
Well,
you
there's
see
no filter, right? It's
and there's no
just
filter, right? Yeah, exactly. So I'm hoping that January 1st onwards, they're going to see the next time that my daughter and my son imitate me, I hope it's going to be kicking a soccer ball around. I hope it's going to be like skiing. I hope it's going to be like, you know, hugging people because those are the things that I want to do in 2024. And, I've already started. I think, it's good to um, kind of get yourself prepared because get your list organized in terms of what are you going to be your goals, what's your new perspective on life. Putting some thought into it is a good idea, um, and then a good action plan, and then make sure the people around you know what you're trying to do, because you're going to need their support to make any changes permanent, because as we all know, New Year's resolutions usually die hard after end of January, February, and then we're back to our routines that we know so well.
right, right. I mean, so you were talking about depression and anxiety, which is very real for many
Yeah,
people, and even people who had perhaps you know very low-lying depression
yeah,
or anxiety that always was manageable had become unmanageable,
yeah,
or you know what do you I mean, clearly this interview is only for educational purposes. You're not diagnosing anybody, you're not giving medical advice to anybody. um, but for people, like, I love this idea of setting goals, right? It's all about setting purpose, and I think that when you have a clear purpose, it helps to lift you out of whatever is going on in here sometimes, right? I mean, it's not a cure-all, but I think that it does help gain focus. It's kind of like the shiny object syndrome in a little bit, right? Like if you have like a pretty thing to look at, and all of a sudden I'm really excited about that thing, whatever it may be, even for those few moments, maybe you can change your mood or
yeah,
whatever. But um, I'm sure, there's people who do need to have prescription medication as well as an assistant. But in terms of lifestyle stuff,
yeah.
what people can do, aside from setting a goal or whatever, um, what are some of the other things that you recommend people do if they're suffering from depression and anxiety?
Yeah. So, let me start a little bit with describing what depression and anxiety is for your audience. I think most of us think of depression and anxiety as, when I'm depressed, I'm sad. When I'm anxious, I feel, anxious and jittery. But there are actually more features to the diagnosis of depression and anxiety. And some of those features can include things such as changes in sleep. So some people sleep a lot more than they usually would, or some people will sleep less because they just are restless through the night. We also see people who have changes in appetite. Some people will kind of eat more to emotionally cope with their stress. Some people eat less because they're just so nervous. Um, you might notice changes in your attention and focus. So all of a sudden, someone who is sharp and really high achievers and producing really well at work are now making mistakes, having a hard time making decisions, just making, not focusing really well, having to read pages over again in a book. So that can be also a feature of potential depression. We see people who have more negative thoughts, thoughts of not wanting to live. Some people may have suicidal thoughts, more active thoughts, and maybe even planning to make an attempt on their life. Um, Individuals who are depressed also may have low energy, low motivation to do things. people's sexual health changes when they're depressed. Their libido may go down. And so you're right. Many doctors are like, okay, I got a medication for that. I'm going to get you well. I kind of echo what you kind of alluded to, Risa. For mild to moderate depression, I try and make medications kind of a second option as opposed to a first option, because for mild to moderate depression, we can do things in our life to reverse that. And the things can be pretty simple. And I feel that I can give you a list of different things, and I can share a few ideas, but everybody's got to figure out what works for them. What works for me may not work for somebody else. And so my advice always, or my approach to helping individuals find strategies to deal with depression and anxiety, is to give them a whole bunch of tools, starting points, and then I encourage them just to practice each of them and figure out what works best. And it's better not to have like 10, 15 different things. Have 2 or 3 that work for you. And so you can kind of rotate them so that you don't kind of get used to one. And then every situation might benefit from a particular coping strategy in your toolbox. So that's where I do a lot of my work for people who have mild to moderate depression, kind of working on some strategies. So some basic things, first of all, making a list of the stressors in your life. Sometimes people get so overwhelmed and they don't know what they're overwhelmed about. And so
that would be me, actually.
I'm the same too. I have to I know I'm stressed because I'm irritable and people are telling me stop being so stressed. And so then I have to sit down and think about it. And so kind of enumerating the stressors is good. Right. And then kind of figuring out some, being reflective about those problems and seeing, are there some that I can let go of? Because they don't really matter, but I've made them to matter. Or there's some that I can problem solve, that I can try and sort out. Like, so if it's, I've got to figure out how to pay a bill, but I don't have enough, finances in a particular week to pay that bill. Maybe I can kind of figure out some strategies just by kind of thinking it through and taking one problem at a time rather than all of them. So a problem list of your stressors and maybe some solutions is a good place to start. And another thing that I suggest for people who can't even get to that stage because they have so much angst inside is they got to detox that anxiety and stress. So good ways to do that. Exercise is a phenomenal way. Burning off the calories. Well, I say burning off the stress is a great tool. You can do that in kind of more moderate, mild exercise, going for walks, being in the fresh air, taking the dog out, socializing with people on your walk, or more intense forms. Some people, go and do boxing, let that, physical aggression on a punching bag take out all your, stress. Whatever works for you, that can make a huge difference. And not only does that help your mind with respect to improved mood levels, less anxiety, but also we all know that, physical activity helps our body as well. And other things that I do when you're in the moment of feeling just overwhelmed, we always hear about deep breathing, and we always hear about it because it works. I think when it's done right, and when people take the time and the space to do it, it's a very simple tool, and you can just sit at your desk, when you're working, take a minute or two out of your day. Wow, it makes a huge difference. The regulating your breathing can definitely, balance out your.
Is that what it's? I remember that's a phone.
It's a phone. It's an old-fashioned phone. I'm an old-fashioned guy, so I
Who
keep.
has a landline these days? It's amazing. I feel like I'm back in 1994.
That's right. Well, you know what? I the other day I was showing my daughter the rotary dial. Do you remember that one?
Oh yes, of course.
And this is topical. This is topical because we have no patience anymore.
Yes.
to stop and slow down your day, it's so much hard work to get people to do that. Do you remember when we had to do the rotary dial? We needed a lot of patience, right? And if you made a mistake, you had to
Oh,
do it all over again. Here now, if we can't get someone on the line within a second, if we get, even if it's like the line is not connecting right away, the frustration, the irritability that comes out is phenomenal. And
yeah.
so, I feel that we did a better generation a better job in my generation with respect to more wholesome types of ways of coping with stress. We would engage with our friends, our family. We would be outside playing sports with our friends. We would, TV time was so much more limited. Screen time was, not even, a factor back then. So, I think I didn't plan that phone call, but it's a good point. Like we're always, there's beeps everywhere, right? We've got to answer a phone. We've got to, you know, deal with a ping on a WhatsApp, or we're just constant, and our brains don't rest.
Yeah.
And so, I think that deep breathing, not only that the actual breathing piece is helpful, chemically to the body, but the fact that the brain is taking a little bit of time out to detox from all of those, intense pressures that are coming in that we don't realize what it's doing to our brain. And anyone that I know that has taken some time out to detox from technology come back to me and have profound benefits, way better than medicine. And
Mm.
and my only challenge then is to get people to sustain those habits, those new habits. That's the biggest challenge, really. I think all of these things work well, and we don't promote them well enough, right? We always see on TV the ad for a medication, the ad for a specialized treatment program. These basics, there's some basic things that the science has proven works well: deep breathing, meditation, yoga, exercise, healthy nutrition. Those things work, and we should be doing more of those. Physicians and physician leaders should be promoting more of those, because not only will they make people who are unwell better, but also from a preventative perspective, people who are stressed will deal with their stressors better and not develop depression and anxiety and have to require healthcare services. And we definitely don't do enough on the prevention side, and we have the science that proves the benefits of it, but we just it's tragic that we don't do more about it. But I just to let your audience know, for mild to moderate depression, all of these kind of non-medication strategies work and can get you out of depression. The people who have the more severe depression, those tools are important, but certainly in those cases, medications can kind of help bridge the gap, and get people well. So I
And I
encourage.
don't think it's an either or, right? It's
No,
like on top of,
on top
and
of, yeah,
and I would even add, if you have good friends, and especially friends that make you laugh. Like
yeah,
I feel like my mother was like a huge advocate for laughing every
yeah,
single day, and it used to be like, oh, whatever, mom.
yeah,
But it's true. There are like physiological
yeah.
effects to laughing every single day, right?
And so laughing is good, crying is good. We have to do more of, being in our emotions,
Mm.
because I think, when all of us can probably, um, acknowledge that a good cry can be healing, and and also deep laughter can also be healing. And I feel that, my daughter is a good example of how someone else's laughter can be healing as well. She has one of the most loudest and deepest laughs, and like it can be a very minor joke where I might haha, she will just, like, you can hear her in the house laughing, and just watching her, so happy makes me happy. And you're right. Like I think we should find joy and laughter in the things we do, and rather than spend time in the more negative emotions of anger, and irritability, which I think more of my time tends to be in that space because of all the competing stressors I've got to deal with. But we know that the moments that we're around people that we love and that we can laugh, or we're at a comedy show or we're watching a funny movie, it's just infectious. You feel good. You have to feel good. Why can't we do more of it, right? And I think laughter is a good medicine, and I definitely encourage people to do that. It's not as easy though to find laughter these days because we see so much negativity.
Yeah.
But you know what I do, Riza, for good laughter? I go back to the good old days and the shows we had back in the day. You know, certainly one that I'm introducing my daughter to is like Full House. And it's
Oh
great
yeah.
because we get to go back in time, my wife and I, good wholesome laughter, and we just and good family values and great role models. We don't have shows like that anymore, so. For those parents out there, take your kids back to the good old times. Even the music. I got my daughter to I think what was it? Wake Me Up Before You Go Go. I said, let's sing this song together because this makes me happy. This was back in the day when I was dancing around and now we sing that
Who doesn't
together.
love a little wham, huh?
Yeah, exactly, right? So, I try and bring her back to, the happy times and take her away from some of the, technology stuff that I think, there's some benefits, but there's some poison to some of the things that new technology brings to people's
Yeah.
mental well-being.
Yeah, no, I agree. I agree. Like you were mentioning, there's just all these like little things that we can do that really add up.
Yeah.
And not only does it improve your mental health, it improves your physical health as well, right? I just feel like stress is so toxic, and I feel like we really underestimate the power of stress. I feel like from people from North America, like we get, there's a certain amount of weird pride for working really
Yeah.
hard and being stressed out. I'm so stressed out. I'm so
Yeah.
busy. I'm so
Yeah.
busy. Um, that I don't know where that happened or when that happened. I mean, I'm guilty of it too, you
Yeah.
know. Um,
I mean, for me, it comes from my forefathers. I think that, and I think culturally as well, in my own culture, got to work hard, you got to succeed, you got to, be at your best. And, maybe we needed that. That was survival mode, right? For some of us who came, parents came to the country with very little. We had to work hard. We had to work harder than others to get where we are.
and that is
Like,
true. That is
yeah,
definitely a fact. And I'm grateful because I definitely have very strong work ethic
yeah,
because of my parents,
yeah,
because they did come here with nothing.
yeah.
Um, and so I am truly grateful for that. But it's like, I feel like then we kind of take it to we have
Nth
like the
level,
extreme
yeah.
version of it now.
Yeah, that's right. I think that's where, it all comes down to balance. And I think that people like us, we have to recorrect our balance or make sure that we don't lose touch with what's important, right? And so work is great. I have to say that I tell my patients that work is healthy. Work is healthy because it gives you meaning. It might take some of your financial pains away. It's social or should be social. Um, it allows you to have structure and routine in your day so that you sleep at a right time, you go to bed at a right time, assuming you're not doing shift work. Um, and it allows you to kind of feel productive. And so I think work is healthy, but at the same time, you need to have that balance so that when you're not at work, you are not at work. You are doing things that are bringing you, joy, bringing you happiness, that is tapping into other parts of your brain that you don't get to tap into on a day-to-day basis at your work. And that helps you form relationships that are outside of work. And so I think balance is key. And so, you're right. I see more people have this attraction or addiction to work because it maybe makes them feel better, makes them feel it's also a form of escapism. I know a lot of people who use work as a way to get away from other things. I'm unfortunately one of those individuals.
Oh, me too.
And yeah.
Yeah, it's great. It's really
It's
works,
it
by the way.
works. I mean, I feel empowered. I feel like, my kids don't see how good I am all the time. I'm just like sometimes an annoyance, but work always appreciates me or finds a way to appreciate me. So I feel good. I get some positivity out of work, but sometimes it's become my pure escape, and I spend more and more of my time there. And I think we can all resonate with that. So you got to work hard to kind of not only regain that balance, but also maintain that balance. And it's not one thing. It's not going to be a situation, I don't think, for people where they just turn off and turn this on. I think it's a work in progress, and I think if you treat it as a work in progress, then you're not going to feel like you're a failure, that your plan to balance life or rebalance life has failed. And so, I have kind of, what my approach has been, try and be a little bit better each day. And if I slip, or when I slip, because I do slip, then try and be quicker to come back on the right path, or my path that I choose to live. And the path that I choose to live is one that is less work, more family time, um, less stress, more positive thinking, and one that really focuses on relationships, and not just my family relationships, but my friends. I mean, I've ignored so many of my friends, because of my work. And it's tragic, because I can probably say, if I had to list my top 5 moments in life, they've not, maybe one of them has been at work, but the rest have been with family or friends, or when I'm doing leisure things, or something outside of work. But I only spend probably 10% of my waking time in those areas, and usually it's because I have no choice. I have to put the kids to sleep, or I've got to take them somewhere. So I've got a lot of rebalancing to do, and I think a lot of us do. COVID has really shifted us, but if I can do it, anybody can do it.
Right. And I'm actually really grateful that you're so candid about it, because, you're the doctor, right? You're the expert who knows what they should be doing, yet
Yeah.
you still fall, and you
Yep.
still, you know what I mean, still need to correct yourself, which I think is great, because it just gives, I feel like we all need to give ourselves a little bit of
Yeah.
grace, right?
Absolutely.
And that nobody's perfect, and that's okay,
Yep.
and that we could sit in our imperfections and
Yep.
know that tomorrow, we can try to do a little bit better. And
Yeah.
um, so I think that's just so beautiful.
Yeah.
So as we kind of begin to wrap this up, and we're, 2024 is right here. And I think many of us are ready to put 2023 to bed, forever, and kind of look forward and create a new, you know, have a new reset, have a new sense of purpose and self, um, and just kind of thinking, like, what do you what do you recommend? Like, what do you kind of, I guess, just kind of recapping some of the things that you were talking about. So, what are some of the immediate things that we can do for ourselves in January to try to create, better mental health habits moving forward?
So I think first thing is a simple pen and paper, and writing out just a simple list of what are some of your pain points in life, and what are some of the things that you want to do for yourself. And then have another list of what are some of the things you want to do for others. And I think thinking in having those lists is going to get your thinking in the right frame. Um, and it's important for us to kind of identify what we want, because everyone's going to be different, and then kind of being gentle with yourself in terms of how to accomplish those. So don't go target 10 different things and try and expect that you have to shift by the end of January. Take one or two things and see if you can start making some movement on those goals. Um, and sometimes I find that it's easier to bring in, your family and other people into these lists, because I think as I said earlier, consistency in our New Year's resolutions is a challenge. Most, I'd say 80% plus people will forget about the resolutions and move back to the routine, and that's normal. That's natural habit and comfort in habit. But if you have other people kind of holding you a little bit of accountable, then that's gonna help you succeed in making these changes in a more permanent fashion, because sometimes you don't get the intrinsic benefit until you've done it for a long period of time. So, I think having people to keep you on track and remind you of why you're doing these things will keep you moving in the right direction. I think it's really important to be good to each other. I think when, you start, well, say to me, I started getting ready for January 2024. One of my goals was to be a better and more attentive father and husband. And that was my focus. And so I just little things. I said, I'm going to now, when I, hug my wife, I used to just do the quick one-hander hug. No, I got lots of love. And I give her a full hug. And she was like, what are you doing? I grabbed her hand and I gave a full hug and I made it count. It wasn't a 1 second quick normal routine hug of the morning just to say we're still married. It was, we're still married and I love you and I'm happy to be in this moment.
Aww.
That one thing made me feel happy because all of a sudden I'm taking a bit of a break. I'm bringing joy, reminding me of the joy that she brings. She's like, whoa, what's happening here? I want that to continue. What do I need to do to make that continue? And it actually it shocked the system, to be honest. So little things like that. Don't be afraid to step out of the box and do something dramatic. I mean, we can sit down and think about what's going to make my wife happy, what's going to make my husband happy, what's going to make my partner happy, what's going to make my kids happy. I can tell you exactly what it is, but I don't do it. Do
Right.
it. Do it. Try it. And one person in a family unit can change the entire family unit. So be that leader, be that person, and you will bring greatness and happiness in your life just by doing those little things. So be good to each other, listen to each other, and I think also be good to yourself. I think it's important to, reframe your life from, I need to do this, I have to pay this bill, I have to work, to, I want this for me. I want to be a better person. I want to have that space where I focus on my happiness, not only, intrinsic happiness, but just true material happiness. And, I want to be happy, succeeding in a sport, or happy reading, or happy playing, a musical instrument. For some people, it is happy retail shopping. As long as it's not causing harm, it's okay. So pamper yourself, be good to yourself, and spend more time doing that. Or if your lifestyle is so flooded with competing things, even finding 10, 20 minutes in a day to do that goes a long way. And then the last, thing that, I mean, there's lots of things, but the last most important thing is detox from technology. I love technology. It's brought a lot of good things to the human race. But, as a psychiatrist, I can tell you that technology has been toxic to our minds and continues to just worsen. And I think we have to be mindful and careful of that. And, I have detoxed. I detox a couple of times a month. Once is when I go for a massage, because obviously I'm not allowed to use my phone. And that's why a massage relaxes me, because I'm detoxed. And one other time where I kind of forced it, and wow, I felt happier. But it's hard to detox, and you got to find ways to do it, whether it be a partner helping you with that, a lockbox, a timeout phase during the day. Find that time to disconnect from technology, and just embrace yourself in organic moments.
Does it matter? Are you talking about a 24-hour detox, a 3-hour detox, a 1-week detox from technology?
If you can do an hour, do half an hour, take baby steps. Just take baby steps. It'll make a difference. Obviously, the more time away from technology is a good thing, but telling people, to take a day away is hard for some people, and some people are so, it's their lifeline. And try it. Take a from a 14-year-old kid, take their phone away, see what you get. You're going to get irritability, you're going to get anger, you're going to get oppositional feelings. That means they're addicted, right? When you see those impacts from withdrawal of a unit or device, that's withdrawal that you're seeing. So, you have to do it gradually, and you have to do it, in a patient and collaborative way with your child or with your loved one. But, it's treated as an addiction.
Yeah, no, absolutely. Oh my God, this has been so great, Sujay. I cannot thank you enough. This is just a perfect way to like end the year and start anew. And I'm so grateful to you, to meet you and Brenna and the kids. And
Yes.
you know,
Well,
it,
thank
it
you
was just
too.
what?
You brought so much liveliness and happiness to my life. I think that's why relationships are important. I have no idea how we cross paths and why we cross paths, but you brought some really good love and cheer to my family's life. And I think it's nice to share this positivity together, and hopefully we can share this positivity with one or many others.
Well, that's how it works,
Yeah.
right? It's just
Ripple effect. That's right.
exactly. Happy New Year, Sujay.
Thank you, Risa. Nice seeing you. Thanks so
You
much for
too.
having me.